Now to an alarming medical warning regarding products that are most likely in your home, including toothpaste, chewing gum, and face and body scrubs. Turns out many of these products include polyethylene microbeads. They're small plastic particles. They're so small they pass through wastewater filters and they don't dissolve in waterways, which means they could end up in a roundabout way on your dinner plate. Many states have already passed laws to phase out these abrasives. Now, a new federal law signed this week by President Obama gives manufacturers until 2018 to get rid of it. Dr. Marc Siegel is with the Fox News Medical A-Team. So, Dr. Siegel, should we wait before 2018 to get these products out of our house?
Absolutely not, Elizabeth. Actually, several companies like Colgate, Procter & Gamble, Unilever, they've already started to remove these microbeads from products. Now, what do microbeads do? They're part of what's called exfoliative, meaning that the products they're in will help get rid of dead cells on your face. They're in beauty products, they're in some toothpaste, they're in some soaps. But the problem is they're not biodegradable. And guess where they end up? Not in our drinking water, but in lakes. The Great Lakes, there's a huge problem in the Great Lakes with these things. Actually, in Lake Ontario, there's 1.1 million particles of these microbeads per square kilometer. That's an enormous amount. Gets into the fish, gets into the fish digestive system. It's been studied. It can cause liver problems in fish. It can cause genetic problems in fish. And then it binds to the other carcinogens that are in the lake, the PCBs, the other toxic chemicals, and guess what that can cause? Obesity, diabetes, and cancer. It gets into our food supply. I'm not trying to scare people out there, but it is very, very good that this ban is occurring, and it's bipartisan.
Okay, so let's say folks at home are worried that perhaps they could have some of these products. How do you figure out if everyday products in your house include these microbeads?
Well, that's a great question, you know, and I can't believe the coincidence of this, but I actually was shopping for soap yesterday in the supermarket. My wife was like, couldn't believe I'm shopping for soap, and I started looking at the chemicals. You could tell, these ingredients are usually listed on the label, but it's not usually in a bar of soap. We're talking more liquid soap, you know, beauty products, cosmetic products, and in toothpaste. If you have any question, you can ask, you know, the pharmacist to check that for you, but it should be listed on the label.
And we heard from a number of Procter & Gamble, Johnson & Johnson saying, well, microbeads are completely safe for people. As part of an enjoyable product use experience, we understand there's growing preference and they will take time to remove them. But why are we waiting until 2018?
Well, the law's just passed, so we're starting to phase it out. Manufacturers, as of July 2017, will no longer be able to include the microbeads in their products. I'm very happy about that. You know, it's going to take till 2017 for that to start marshaling up. But, you know, the real issue here is nobody can say with any certitude that this is safe for human consumption. I don't like a statement like that because, you know what? We know it's not safe for fish consumption. A fish called a makita was studied in Japan, and it can cause liver disease. It also interferes with the bird digestive system. Birds have died from this. I mean, look, people listening are going to say, okay, I'm not a bird, I'm not a fish. But meanwhile, you eat those things. We don't know what the long-term health consequences are, especially when they're absorbing carcinogens and then getting into our system. Not in your drinking water, but can be in the fish you eat. I say get it out.
Absolutely. Well, thank you, Dr. Marc Siegel, for joining us. Certainly, consumers need to be aware of all of these hazards. Thank you very much.
Great to see you, Elizabeth.
You too.